know, the entire state of California is now under the shelter-in-place order, yet the virus continues to spread around the nation. As we said, you're in the nation's capital. I'm curious what kind of insight you can give us to what the conversations are like among members of Congress. Does it feel like both parties are taking this seriously and are really there to work together on this?
There is now an urgency. There's an urgency first to get medical supplies out. Our heroes are our doctors, our nurses, our healthcare providers. We need to get them sufficient N95 masks. We need to make sure they have sufficient hospital beds and that we're mobilizing the Army Corps of Engineers to help build that capacity. We need to make sure they have enough ventilators. I'm glad the president has finally invoked the Defense Production Act, and we need to adequately fund that so that we can get these medical supplies. The second thing we need to do is deal with the economic crisis. I mean, I'm hearing from people in my district, they're being laid off. And in certain cases, they don't have health care. For example, airport workers, not just the flight attendants or the pilots, but the people who are doing baggage attendants, the folks who are cabin cleaners, the folks who are wheelchair attendants. When they've been laid off, they need health care insurance. We've got to get that. They need some form of economic assistance so they can buy food or pay rent. We need to do that, so we're working on an economic bill.
I want to go back to something you mentioned. You talked about President Trump invoking the Defense Production Act. We've kind of heard mixed signals from him on how far he's taking that, if he's actually using it to direct businesses to get those medical supplies to where they need to go. What insight do you have? Because it seems like what the president says in those daily briefings is not always what the situation is on the ground for governors around this nation.
Well, you're right, and that's why Speaker Pelosi and Senator Schumer have been saying it's not enough to just sign a Defense Production Act. What are you doing? In Britain, they have told the Rolls-Royce factories to actually start producing ventilators. Who are we directing to produce masks? Who are we directing to produce ventilators? The government ought to be paying a premium and providing economic incentives for these companies to do that. And of course, we have the authority to order them to do that, but we also ought to be compensating them to do that. And this is something Speaker Pelosi has been pressing the president and the administration on.
Let's go back also to the issue of broader medical supplies, not just ventilators, gloves, masks. What can Congress be doing? You talked about funding some of these issues. Tell me sort of what your role is as a congressman in helping facilitate these huge gaps that we're seeing in our healthcare system.
Well, it was 57 of us who wrote to the president to invoke the Defense Production Act. I wish he had done that a month ago. We can fund that and make sure that the businesses have the funding to be able to produce these things. Second, we can call and have called for the Army Corps of Engineers to be called up, and they can help with putting together temporary hospitals. They don't have to construct these from scratch, but they can help creating beds and more capacity. Third, I've called for in the stimulus to pay a 50% bonus to any critical healthcare provider or worker. We need to be rewarding and incentivizing as many people to be on the front lines dealing with this crisis. So those are the types of things Congress can do.
Two of your colleagues in Congress have actually tested positive for coronavirus. I'm curious about your own health. What kind of steps are legislative leaders taking to protect members of Congress during this critical time where we obviously need you all to be able to work?
Well, I'm doing everything, as you can tell, remotely. I'm not going into the studio. I'm not going to the Capitol. I'm practicing social distancing. We're having town halls in our district. With Facebook Live. I've been just had a conference call with airport workers in the district, but I chose once not to be flying back and forth. Ordinarily, I'm be flying back and forth, and I'm doing everything that the CDC recommends. It's important for people to understand two things. This disease can hit anyone. It's not just the elderly. It can hit anyone, and we all have to be taking precautions for our families and ourselves. And second, it's only if everyone literally abides by these recommendations of staying in place, of having social distancing, that we will be able to get over this faster. Otherwise, we're in for a much longer period.
As you know, one of the biggest challenges has been the lack of testing availability, but we are seeing people like members of Congress and NBA players who don't show symptoms be tested. What are you doing to help boost the availability in places like California, New York, Washington, where we've had the most cases and yet it seems like in some cases the least help?
Well, we've prioritized this, and when the CDC director testified in front of Congress, NIH director, I said to them, why aren't we using the WHO test, the World Health Organization test? That was the biggest misstep. We ought to have been using those tests like Korea, like so many other countries were using, and getting them widespread. Now we are putting tremendous pressure on these agencies to say, look, we have to get testing to be available. And it's important that people get testing not based on their social status. If they're an NBA player or a member of Congress, they get testing based on their need. If they're showing potential symptoms that would make them positive for COVID-19, that's when you should get tested.
When do you think more tests could be available?
I listened to Dr. Fauci. He had said this week, unfortunately, while the testing is improved, it hasn't been at the scale. I'm hopeful within the next 10 days. But look, the studies are absolutely clear. In South Korea, what's allowed them to succeed is testing, and testing in a smart way. And there's a great article on Veneto in Italy, and what they've done is by just testing 1% of their population, but testing those who were most likely to have COVID-19 and then testing anyone they were exposed to. They've done it in a very smart, strategic way and quarantined them.
Finally, I know you guys have been working around the clock on this $1 trillion bill to help rescue the economy, do some of the things you're talking about. Tell us what the status of that is and what you expect to see over the coming days around that package.
Well, my push has been we need to have cash infusion to people who need it. We need to get $1,000 right away, but not just one time. We need this for probably a course of 6 months. I mean, you have the restaurant business be devastated, literally layoffs of 25, 50%, some cases 75%. You have airport workers devastated. You have so much of the economy, almost 2 million unemployment insurance claims that we're looking at. And people need economic security. So I have been pushing for that. What I've said we shouldn't be doing is just providing large loans to corporations. I mean, the shareholders and the executives aren't the ones I'm concerned about right now. I'm concerned about people who are out of work, who are having a tough time making rent, tough time putting food on the table. And I think almost the vast majority of the $1 trillion stimulus should go to them. That is the big debate right now in Congress. The Senate plan, in my view, puts way too much of loans like the bailout did to industry. We're going to get something done. We're going to pass it, but we're not going to roll over and allow for the stimulus, the bailout, to go to corporations, big corporations, and not to workers.
Is there one particular thing that you think the federal government could do right now that would help California?
I think what we need to do is get any hospital capacity. We need to have our military ships deployed if they can provide more hospital beds, and our Army Corps of Engineers deployed to create more beds. The governor has said we're probably going to have a shortfall of almost 20,000 beds, and I've been pushing the administration to get that capacity up.
All right. We know that the governor's working with you on that. Thank you, Silicon Valley Congressman Khanna.